Thank you, Mr. Speaker. It's my honour to respond to the speech from the throne. I'd like to start by thanking and congratulating the Honourable Lieutenant Governor Kwong and his amazing wife Mary for serving and representing our great province in a dignified and honourable fashion. Mr. Speaker, when I was first elected, much has changed. We're in the midst of a world economic crisis. We've had H1N1. Hopes and dreams across the world have been shattered, and many in this world suffer from despair. Our province has been hit particularly hard economically due to our natural resource revenue, declining at a time when we were in the midst of catching up to our recent economic boom. Mr. Speaker, the truest test of a character of a people is not how you fare during the good times, it's what you do during the tough times. Now, the speech from the throne, as it applies to Albertans and to my constituents in Edmonton-Meadowlark, I'd like to touch on a few points. One is Alberta's fiscal advantage. Major advantage that we have gone through during these tough times is that, one, we have no debt. No province in this nation can say that. Secondly, we have money in the bank, in our RSP account. No province in this nation can say that. Thirdly, we have money in a savings account, in our sustainability fund, to help with the priorities that matter to people during the difficult times. Priorities such as looking after educating our children, caring for our seniors, looking after our vulnerable, and providing services on the human sector side. We do have challenges, Mr. Speaker. These are challenges everybody in this nation and everybody in this world faces. At the same time, on the economic side, we have an economic climate with the lowest possible taxes to encourage the spirit of entrepreneurship in this province, to encourage small business, and to create what matters most to people: jobs, J-O-B-S. We have the lowest unemployment rate in the nation. During the tough time, we still had 100,000 people flock here in search of jobs and hope so they can care for their families. Second issue is building safe communities. Safety is one of the main issues for the good people of Edmonton-Meadowlark. And we have to fight crime. We have to get tough on crime with the bad guys. There are many people in Alberta, many people who are going through difficult times and they make mistakes in life. And many of them have interaction with the health system and the criminal system. It might be because of homelessness. The root cause of homelessness are addictions and mental health issues and sometimes poverty. Are these hardened criminals? I'd say these are Albertans who are having a tough time. We got to look after them. That's where that commitment of building affordable housing units, getting our mental health patients the help that they require and the wraparound services that they require, marrying mental health and addictions so we can provide better, more effective care, because many times patients have comorbidities. Not only do they have a mental health problem, they have an addiction problem, but they also have a medical problem. Breaking down silos and barriers so we can address these issues. Third issue is the increasingly competitive global marketplace. We need to continue to foster the Albertan dream, the dream of entrepreneurship, that if you want to work hard and work smart, you can achieve anything you want. Sometimes it requires a little bit of luck. But the two main characters are hard work and smart work, and then be in an atmosphere where those dreams can be encouraged. And that's what this province does. I can say this. And part of that starts with a good education. Let's talk about regulations. We can over-regulate, under-regulate. Really what we need to talk about are good regulations to enable dreams to happen versus disabling dreams to happen. We're a major supplier of a safe supplier of energy and minerals and resources to the global marketplace. Bill 105 will address the Alberta Competitiveness Act to make sure that we are the most competitive in this nation with respect to the energy sector and our resource sector. Fourth issue is environmental stewardship. We do have to be careful with our environment in this world. I believe in Alberta we took that leadership with first the intensity targets. I think there can be more that needs to be done. We have solar power, wind power. Carbon capture and storage is one solution. And there's individual responsibility. I think we all as individual Albertans can play a major role in improving the environment of the great province that we live in. And we can be a beacon of hope to other developing nations in helping them with their environmental challenges, such as India and China and other nations that are up and coming who want to have the life that we have here. Mr. Speaker, the most important thing I'd like to talk about, I mentioned a quote by late Martin Luther King Jr., life begins to end the day we become silent about things that matter. In this House today, I'd like to break my silence about the number one issue that affects not only our great province, but also this great nation and many of the G8 nations. That issue is health care. Dealing with health care, it's actually beyond health care. Health care is the symptom, not the problem. The wealth of our nation depends on the health of our nation. The fact that we're competing in a global marketplace, the health of our workforce determines the economic productivity of our business sector. Now, I just have to give you, I think evidence and examples are the best way to deal with this. A good friend of mine, who I won't mention his name, he fell off a bus and broke his ankle and needed a cast. He went to the United States, he was in Florida. He was hospitalized for 2 days and got a cast and got an x-ray, no operation, no intravenousness, no CAT scans. Guess what his bill was? Take a guess. $37,000 US. $37,000 US at a private hospital. So our insurance plan had to get the lawyers involved, and we whittled that down to $9,000 plus the legal fees. You know what his bill would have been had he come to our hospital at the Royal Alec? $600, and we never would have put him in the hospital because he probably didn't need to stay in the hospital. $600, and I think we can deliver health care more efficiently here. In the USA, our good cousins south of the border, they spend an average of $7,500 US per person on health care. Here's the outcome: 60% obesity rates, and the life expectancy, infant mortality rate is less than ours. And that's after 50 million hard-working Americans, hard workers, have no insurance, and they just get Medicaid when they end up sick in our emergency department, then they get very expensive care. This has affected the economic productivity of every major corporation who's competing against the Indias and the Chinas of this world. They have healthy, productive employees who don't get paid too much. Here, we have unhealthy, unproductive employees because of their health. There's a reason that there's an economic catastrophe south of the border. Healthcare. Healthcare is a major issue. And part of healthcare is the drug costs and the legal costs. My health insurance, my legal liability insurance to work in an inner-city trauma center here is about $245 a month. In the US, I'm sure that figure would be at least 10 to 15 times more. In Canada, we spend $4,400 per person per year on the average in this nation, $4,200 to $4,400. And our outcome is we have 30% obesity rates. Life expectancy here is 78.2 years for men and 82.7 years for women, according to the 2008 census figures. But the challenge that we have in this nation is actually times to get access to care have been improving. We in this nation, now here's a critique of our health system in this nation. We in this nation have talked about the Canada Health Act. We have this Canada Health Act, and the 5 principles are public administration, comprehensiveness, universality, portability, and accessibility, but access to care has gotten worse. In this nation, Manitoba, Nova Scotia, Ontario, many of these provinces, their budgets, healthcare is 50%. My comments are based on the fact that I've worked for 17 years, talked to many experts in this province, this country, and this world on what we need to do.